in East LA, which is the underserved population I treat, we haven't been able to use a lot of technology because the patients have issues and barriers, and it's been hard. And we've been doing telemedicine because they don't have smartphones and we can't even see them. And so we had a new patient to our clinic call in maybe March, and she had an A1C of 14%, had type 1 for a number of years, and was really naive to technology. And for some reason, we managed to not only talk her into starting a Dexcom, we got her to start a tandem pump. We did this all over the telephone.
Wow.
And we're able to get her on hybrid closed loop technology. And she's got an A1C in the 7s now, which is a miracle. I mean, just a miracle. And we did it all without seeing her. So we're all like, we really want to know what she looks like, you know?
Yeah.
But we did it that way and it worked. And I can't tell you that I've ever been able to do something that significant with that ease, because the technology and the interface and the ability to teach online is all improved. And in ways that I never thought it possible, which doesn't mean to say I can reach everybody, but it means to say that people who are interested and have the resources to get that technology can.
I love that. What a beautiful story.
So that's why I'm always an optimist, at least about certain things.
Yeah. I love that point too about doing it all over the telephone. Because I've been seeing some clients in a high school setting for mental health, and it is hard to do stuff over the telephone. So it's really cool to hear that that was possible.
Yes, it's changed my reality in a way. It's made me expand a bit. So I like that. And then, you know, I've spent tons of time, because remember, my regular life requires that I travel a lot, because I go and teach, but I'm not traveling. I'm sitting here looking at people just like I'm looking at you. And therefore, you know, I can put a patient on a new system, or, you know, I have a lot of people on loop, and I can see them again in a week, and I can look at their data, and I can do a lot more interactive care. And it's, you know, it's made me even more geeky than I normally am. And I don't get the same kind of breaks. It's really annoying. There is no work-life balance. Not that I ever had any, but now I really don't have any work-life balance.
Yeah, I sort of had that sense of like, do you feel like you're busier now in this kind of virtual? Yeah.
But for me, it's much slower doing telemedicine than does in-person visits. In-person visits, I can sit with a computer and type and talk. When I'm doing this, I have to actually, because it's smaller, I don't know why, but my brain has to look at you like this. And, you know, and so I can't do as much as easily. And for these visits, you have to have a pre-visit with somebody who's a diabetes educator to get all the material. Then it all has to be ready for me. Then I analyze it and do the visit, and then I have to chart later. So it's like double the amount of time per patient per visit. So this is not cost effective. This is not a good way to practice medicine. So telemedicine is not easier, and it's actually more labor intensive and more time intensive.
Yeah, I feel like that is not well captured, like in the discussion of telemedicine.
Correct. And I had a telemedicine visit with my primary care doctor as a patient, and it was like magic. The whole system worked. It was blah, 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 it was, you know, 10 easy minutes, and that was done. You know, and for me as a patient, I loved it. But I know that she had to do all the scut afterward, and she didn't have to download devices on me. But we care about patient-centered care for the patient. But the medical system does not provide healthcare provider-centered care. So if you're going to make my life harder, then I can't give more to you guys. And so it has to be a whole systems change. It's not just one piece, because if I get more time, then I have to document more. Then, I mean, it's very hard in the system to function. So the system needs to change. But if it becomes more burden on providers, more of us are going to stop doing medicine. So it's got to be all of us. I think telemedicine is the single best thing that's happened to us. And I'm not complaining. I do believe that the system needs to change to involve effective telemedicine. And I think that the healthcare systems need to make sure that they give us the staff we need. So they need to give us the staff to talk to patients in advance. They need to give us the time to do the telemedicine. And then they need to give follow-up staff who can do all the prescriptions and the refills and all that stuff. So there needs to be a whole system around telemedicine, but it has to encompass everybody who's a healthcare provider, everybody who's a patient. There has to be a system that encompasses us. So to me, that's what care has to be. And it's not just one piece of that improving, it's all of it improving. And I think that for someone like me, I've always been able to carve it out in my way, but it's been that I've given up a great deal in terms of personal time and in terms of income. So if you actually want someone to make a living and have a life, you're not going to be me. So I'm just pointing that out.
I imagine there's lots of providers listening to this kind of nodding their heads, but I'm wondering, like, because you're such a Jedi master, do you have any like tricks that help you do this more efficiently, or is it just like, it's just a lot of work and that's kind of the way it is?
To be honest, it's the closest to being burnt out that I've ever been in my life. I mean, it's been so overwhelming that I felt like saying, I can't do this so much anymore. And I've actually, made times I take just days off because I can't take it. I mean, it really is harder. And a lot of my colleagues feel the same way. The demands on us, first of all, to have changed so suddenly, but also I can't keep up this pace because I've started to force myself to do jigsaw puzzles. I'm not addicted to like video games, but I now, if I have a jigsaw puzzle, I'll do it and not do other stuff. And I just, it's been hard. This has really been close to burnout. There have been a lot of times when I've just said, I just can't. And also because people are scared and they get COVID. And frankly, I get calls, 24/7 of people. And I've had a lot of people now who've had COVID, and, I want to hold their hands. It's a time that it's okay to be scared. It's a scary time. So I think what it's taken from me has been greater than any other phase of my medical career.
Wow. I appreciate you saying that, Anne, because I think a lot of us look at you as like superwoman of diabetes care providing. And to hear that it's been a lot, I think normalizes it for those of us who are like, this is a really hard time.
It is a really hard time. And I sometimes forget, but because I've now become so agoraphobic that I just don't even like leaving home. But I still have to work in East LA. I go every week. I always have every Friday. And then every Monday now I'm going into my West Side clinic because there are people who need to be seen in person. And, I'm very committed to helping the underserved, and they need people in person. So
yeah.
Done.
Yeah, the other thing you made me think of is like people in the mental health world talk about vicarious trauma. Like we're all, there's the trauma that your patients or clients go through, and then we're also living through a traumatic time. So it's like ourselves, like in a pandemic, and it's just like double.
Well, I know, and there's all sorts of other stuff going on, which I won't even mention. So I have become so sensitive to all trauma that I am on a complete news blackout. I cannot listen to news because it upsets me so much. I have to actually, people will try to talk to me and I'll say, no, we can't talk about that because it's too upsetting. Because I can only focus on one thing, which is being a doctor and helping my patients in this diabetes stuff that I seem to be doing. And, it's that's the thing. I don't have any more bandwidth. I stopped reading books. I mean, it's just like, I can't deal with anyone else's fictional problem, or, I have to take care of these problems. So I really felt like it's just been a really weird time psychologically in terms of dealing with it, which is not to say it's bad. I feel like we just have to deal with it. There's just no other, you just got to go through it.
Yeah. Yeah. And there's that piece of it where like, we don't know when the end will be, which I feel like makes things more, like if I know when the end will be, I can like look forward to that point.
Yes, but I think we all have to accept that the end is going to be a slow end.
Yeah.
Because we have to have, well, first of all, we have a really good way to deal with this, which is mask wearing, in case anyone hasn't noticed. But second of all, we need to get effective treatments, and we need to get a vaccine. And a vaccine clearly isn't a panacea because not everyone will be vaccinated. And we really need treatments, but the problem is that we're not great at rapidly developing things. So you got to test them in human beings and look for side effects.
Yeah.
So I certainly think we're better than we once were at treating COVID. And, I still to this day haven't had a West Side patient who's even been in the hospital. And I had it in March because I got it from patients. And, I was sick for a good month, but I wasn't that sick. I mean, I didn't stop working, for instance. I kept doing telemedicine, even though I was so tired I could barely move. And it is true that when you lose your sense of taste and smell, I thought you would feel neutral, but it means that everything tastes like sawdust. It tastes like something, which is nothing, but nothing is actually a taste, and it makes you not eat. So I lost a bunch of weight. So now I have to, like, have a trainer to regain my lean body mass. The whole thing is just sucky. But anyway,
Yes.
at least I know I didn't die. So I did it. The day before the clinic closed down, I got it from a patient and his wife, but it's all fine. And I just think we all have to accept that life will return to normal, but slowly. And it's not going to be like one day you wake up and you're going to be, waltzing in a movie theater and, saying, oh, let's have popcorn and, spit on each other. It's going to really be a different world.
Yeah. Yeah.
So, but young and healthy people and people with type 1 diabetes do fine. I mean, I have had so many patients by now with type 1 who've had it, and it's just a blip. They don't do badly. I know people can do badly. I'm not minimizing this, but my optimism for my well-controlled patients is that most of them do pretty well. Some don't. I mean, and you certainly read about them, but in terms of my own universe, it's been nice. On my East Side patients, though, my poorer patients, they have been dying, and they die horrible deaths all alone in ICUs. And I have seen hell on those patients, hell. So I see both. I see people who, have the worst outcomes, and I see people who have the best outcomes. So I know both are possible. So it keeps me, some sort of middle path of sanity, perhaps.